staff from the top of the organization to the lower, more junior levels of the organization can buy into that leadership and be excited about it, because they might not see that the same number of things that I see from the perch that I happen to sit in. If I convey that information into the organization, people say, "Oh, Brian said X, and that's why we're doing Y, and now I feel better about things." So I think communication is really important. I think optimism is really important, and I think being honest about where you stand. Sometimes you have to shut a program down, and people who have worked on it for a long time might not like that. But if you can walk them through why it's important for the health of the company and the long-term success, people usually get there.
Mm-hmm. Yeah. Yeah. And I mean, in this case, you didn't shut the program down. In fact, like that leadership works both ways. Like you've got to lead the troops, but you also have to sort of lead upline. I don't want to speculate, but to your point, like you have shareholders and board members, some of whom may be thinking like, let's axe this one. It's going to take too many resources and too much time to get this back on track and to re-engineer the program. So two questions come out of that. One, like how do you lead upline? How do you rally the folks who have decision-making control about pipeline decisions? And two, when a project is going to take a little bit more in terms of resources and time than perhaps originally anticipated, how do you fund it? Especially in a difficult, the difficult funding environment that we're
very challenging. Two very challenging questions. I think that managing up, which includes investors, right? So the board, I serve at the pleasure of the board, and so I do think about I'm wanting the board to be very happy with my performance, but I've got thousands of other board members, and they're called investors, and there's social media. They have a voice, even if they only own one share or $100 of stock.
Yeah, they're usually the most vocal too, aren't they?
They might be, yeah, and sometimes, unfortunately, they might have the least amount of experience in the field. Mm-hmm. And that happens, but they still can have, in many ways, an equal voice to people who might own 1 million shares of our stock. So you actually find yourself having to manage in many directions simultaneously. I'll tell a short story. There was a program that I thought was really challenged. I wasn't particularly supportive of. I didn't think it was right for the company, and I got good advice from a board member who said, you're approaching it in a way that you think would resonate with you. Instead of going through the approach that you think would make sense to you, try this other approach. And in this case, it was basically the data. So he said, why don't you go knock on 100 doors and show that 100 out of 100 companies weren't interested in partnering with you on this program, and then bring that data back. So now it's not Brian talking about Brian's opinion with Brian's experience, good or bad. This is just data. The data says that 100 companies were not interested in program X. Okay, I think the data speaks. We don't do program X anymore. So there are many ways to convince people or to be persuasive, and one way is not the right way. You have to kind of be flexible and think about your audience. It's the same with funding. The second part of your question, I often say around this organization that you might have a great idea. I mean, a really spectacular idea, but we can only do the work that we can fund. So even the greatest idea in the world, if it's not viewed as a great idea by the investor community, it's not going to happen, because there's not going to be capital available. So there are constraints that are out there in running an organization. And if you spend too quickly, even on great ideas, and you're not keeping your head up and looking at the macroeconomic environment, you may find yourself destroying your company in a financial way through its capitalization structure that has nothing to do with the fundamentals of your program. And similarly, if you just sit around and you wait always for better days, like, oh, maybe the stock will be higher tomorrow or next week or next month or next quarter, the world shifts and moves on. So you have to be constantly paying attention to both the micro and the macro, and factors that go far beyond the fundamentals of your program. You got to tell people what you're doing, or it's a tree falling in the woods. Like, all of these things come to play and make this job and this activity of developing new therapies incredibly difficult. But it also is incredibly rewarding. You sit with someone, for example, who has a spinal cord injury, and they say, I'm really counting on what you're doing, not for me, you won't be able to help me, but someone like me. And it's just, I mean, the chills, right? And so you get
Hmm.
up the next day and grind like you'd never grinded before because you're working for sort of a bigger picture, bigger mission.
Yeah. Yeah. How did you, so I mean, you had, as you noted, great news end of 21 on the dry AMD um, product. How did you like what you talk about the capitalization structure? Was there a specific sort of strategy to funding the reboot of the spinal cord program?
Um, I think it was pretty straightforward at the time. We acquired it from another company. We knew what the deficiencies were. I mean, we were the ones doing the diligence, so we knew what we were getting into.
Hmm.
And we basically made a bet, a calculated bet. And that calculated bet was that our manufacturing team that had been so successful with the dry AMD program, so successful that they got a $50 million upfront payment from Big Pharma for their work, we made the calculated bet that they would be able to do similar successful campaigns with the oligodendrocyte progenitor cells, i.e., the cells of the spinal cord. And they were, the data that comes off of that program, the identity of the cells, the consistency and control of that program, the RNA-seq data that we see when we compare the old way of making the cells and the new way of making the cells, it was a tremendous success. So, very, very happy with how we were able to do that transition from that program. And then really that's the long-term goal. I mean, there's no reason that transplanting retina cells and pulling vision back in the condition of dry AMD, there's no reason to believe that that's the only place in the body where that kind of cell therapy can work.
Yeah.
It shouldn't be limited to just the eye and the spinal cord. And so if we can apply what we bring on the manufacturing side and the process development side and our ability to control the differentiation of cells and the lineage of cells, that is something that we could apply in a lot of places. And so we might be able to multiply our success. And that really is how to build a big sustainable company rather than just, lucking your way into one asset that got a pharma deal and, hoping that years later it ends up throwing out, royalties for you, right? You've got to keep moving forward and build on the technology and the lessons and keep your advantage, your competitive advantage over others.
Yeah. Yeah. That's a great segue to another question I had for you. I had in my head sort of a linear chronology, a linear approach to this interview, but now it's now I'm moving all over the place because you just gave me a good segue to another point that you and I discussed when we last spoke. And I mean, it could be taken as sort of one of those great big audacious bold statements, right, from a biotech CEO when he says, we envision becoming the Amazon of cell therapy, right? Like having a product for everything
Mhm.
rolling out of our platform. And you do have programs as we noted, and spinal cord and ocular indications, and also auditory, right? You've got a candidate in the
Mhm.
works that's related to hearing. What else? I guess what else would you see? If you were going to dub yourself the Jeff Bezos of cell therapy, uh, what other areas do you look at and you go, there's no reason, like you just said, there's no reason why this approach shouldn't work here or here or here. And I know this, I'm treading into potentially dangerous water. I don't want you to, make any announcements that you shouldn't be making right
Not
now,
at
but
all. No, you're totally fine. It's I welcome the question because we should be clear about the analogy because there are some people out there who didn't understand the analogy and completely missed the point and thought that I said that we would be as big as Amazon. And Amazon is like 10 or 15 Pfizers. We clearly were not going to be Amazon in terms of the same size. The point of the analogy is that Amazon began as a bookseller, but they weren't book experts. They were delivery experts. And they were able to move what they learned and what they were really good at in logistics and delivery into selling everything. The analogy is that we started with an ophthalmology program. We got a big farm partnership for an ophthalmology program that continues to advance and it looks incredibly exciting, but we're not ophthalmology experts. We're cell transplant experts. So the point is scale. The point is that we have value inherent in an approach that can scale and go into other areas, just as Amazon migrated from books to, every widget imaginable. And frankly, no matter how big this company ultimately becomes, I'm not sure there are many companies that even have a shot at it. I don't know who has a deeper and more advanced pipeline outside of cancer cell therapy, right? Cancer cell therapy is very established. As soon as you move out of oncology, but you stay within cell therapy, we're essentially a growing center of excellence. And I'm not aware of anyone who's got a superior pipeline to Lineage's in that way of using cells, making them and transplanting them to various parts of the body. Now, I do have the advantage that I'm aware of undisclosed programs that we are evaluating in various ways. And so I can be more optimistic about the future perhaps than others. But that's really the point here, is that there are over 200 cell types in the human body. And from a biological perspective, why would we think that the retina is the only place you can find success? My goodness, bone marrow transplants, we've been doing those for 60 or 70 years. They're pretty darn successful. That's really the same technology. We don't use undifferentiated cells in human beings. We replace the cells that are actually there in the human being, but they've been damaged or are absent in some way. We're just replacing those cells and restoring function.
In keeping with the Amazon analogy, I'm curious about this, and you can tell me that it's in no way, shape, or form in your plans. But it makes me curious when you have a platform and you're an expert at cell transplantation, and you subscribe to at least some portion of the Amazon model. Kind of begs the question about like the Amazon marketplace, the marketplace element of the Amazon model. I mean, could you see a future where Lineage Cell Therapeutics is the expert in cell transplantation for marketplace members, cell therapy programs, for instance? Like, do you see partnership?
Yeah.
You partnered upstream, obviously, with a Genentech deal. Do you see a future where perhaps your partnerships expand sort of laterally?
Yeah, I think all analogies at some point, get stretched and start to break down.
Yeah, if I'm stretching and breaking here, just no, Matt, that's not what we're doing.
Yeah, no. But I understand the question, and I think what I would say is that because there are so many possible indications and applications for this technology, it would be really silly to think that we could pursue them all. And so, yes, partnerships are a great way to do that. We do not have a priori a plan to partner every program, nor do we have a priori a plan to commercialize everything other than our first program, right? That is a business value creation decision that gets made based on many, many factors, right? If you have good access to capital at attractive prices, you're going to want to hold on to your assets for longer, create more value before either partnering them or becoming a commercial entity. If you find that the market for capital is not attractive, then you go elsewhere. And I think the last few years in biotech, is very, very challenging. High interest rates is not a favorable environment for biotech companies. And you saw companies that had IPO'd at $20 and shot up to $80, and then they came back to $5. Well, when you raise money at $5 instead of $80, it's very expensive cost of capital. So I think that on one hand, you have to, considering your partner strategy in the context of your timelines and the value that you're trying to create and what's going on, in your field. But with respect to partnerships as a standalone matter and smaller partnerships or future partnerships, we already struck one. We struck one with the gene editing company, because while our current platform focuses on replacing the cells that are naturally found in the body, the future of this field includes cell engineering, meaning introducing features and capabilities of cells beyond those that are found naturally. maybe in some simple and obvious cases, that would be something like hypoimmune cell line, right? If you want to go outside of the ocular compartment or the spinal cord into areas where, you're fighting white blood cells, with foreign material, the right approach there is to develop a hypoimmune cell line. And so we and some other companies are in that field. But you can also imagine that there might be properties in certain conditions or diseases that would be beneficial, that could either protect cells or give them enhanced properties or enhanced durability. And you could engineer those features into cells so that, for example, this is purely theoretical, a retina cell that is a replacement retina cell is a really great idea and working well for us. But what if we engineered a capability that retina cell somehow was a super performer, and then we cloned those and then we use those, and so maybe they're phagocytosing material at a faster rate or something like that. That's the long-term big picture, and you definitely need to have a lot of partners to be working on and exploring all of these. And so we are planting those seeds while we are looking forward to the ongoing program in dry AMD to be successful and hopefully make this company a lot more successful than the work we've already done. We are planting the seeds for the future, increasing our capability with the lines that we have available and things like gene editing so that we can continue to maintain that leadership position.